I want to thank Avery and Alan for introducing me. That's wonderful. And I also want to thank Alan for giving you guys a definition for hybrid telemedicine. It's a new concept. A lot of people think hybrid telemedicine, that's telemedicine visits partial and then partial in-person visits, right? That's not what our telemedicine is. Our telemedicine is high technology, but also high touch. So having a consulting nurse that supports an individual in their home environment to make those telemedicine interactions really stick, make that person feel they're supported, and help to bridge that gap of miscommunication that happens between the medical community and our waiver clients out in the community. So as Alan said, my name is Shannon Holley-Smith. I am a BSN RN. Just to give you a brief background on myself, Alan is correct. The last year I've been with the waiver population working particular with this program. However, my entire career has been with your population, our population. I have worked with waiver clients since day one of being a nurse, and even before that, I was a CNA for 5 years, and I worked in the home of waiver clients. I've even worked as a mental health nurse out in the community. So I have great knowledge of the challenges that you face, along with the challenges of these individuals in their home and out in the community. That being said, let's move on. So we're here to tell you about telemedicine, a platform to better coordinate care for the CADI and other waivers in your home. And we're going to do a case study example. So I'm going to give you specific examples, but a lot of these barriers that we come across, you probably could fit them into many of our different clientele, not just one specific individual. So we're going to talk about collaboration within the home. So collaboration with the home for us means collaboration with all the supporting care team members. So an IHS worker, a PCA, a family member, the client themselves. So how can a hybrid telemedicine system collaborate the home? How can they all use it? Mental and behavioral health diagnoses. As Alan said, we know that probably 90 to 95% of all of our waiver patients have some sort of co-diagnoses of mental and behavioral health need. Could be stress, could be anxiety, could be PTSD, bipolar, schizophrenia, you name it. If you have a lot of complex medical conditions, you typically have some anxiety and depression along with it. And that's just standard for most people in the medical community. So we'll talk about that as well. Transportation. I don't think to this room of people I need to tell you that transportation is an issue for our individuals out in the community. You are well aware that transportation, getting to transportation and having transportation to and from places in the community is a huge barrier for our individuals on the waiver program. There's certainly a disconnect and miscommunication issue within the medical community for our waiver population. And I think a lot of that stems from a lack of, I call it a medical education, and by that I mean a lot of people don't understand medical speak. Medical terminology is complicated, and a lot of our waiver patients hear big words, hear big diagnoses, hear big steps or changes in their care plan or recommendations, and they tune out and turn off, and they just don't get it. So we'll talk about how a hybrid telemedicine system can kind of support that and help that person bridge that gap. Social phobias and autism. These individuals, I'm not lumping them into the same category. I'm simply saying that people with social phobia and people who have a social disconnect, like individuals on the autism spectrum, it's a challenge for them to get out into the community and interact with people. So having that access within their own home can really relieve a lot of stress and break down a lot of barriers for them and improve their interaction during those clinical visits. We're also going to talk about how you can support medical care and improve outcomes. And by you, I mean case managers, social workers. How can you support your waiver clients and at the same time support good medical care for them and support possibly improving outcomes of medical care for them by using this system? Support independence. That's what our waivers are all about. We're trying to support independence for these individuals out in the community every day. How can this system allow them to do that? Communication with care and team feedback. This specifically means how can using the system provide you, the case managers, the social workers, with a little feedback about what is happening with the system and how that person's interacting with it. So it's important to have that feedback so you know whether it's a good fit for them or not. So let's jump right in with the first one. Improving collaboration within the home. So this particular case study is client S and her IHS worker L. So when client S was referred to us, she of course was a new client, but not just to us. She was a new client to IHS worker L. This particular situation, this client lived in a subleased apartment that was ran by the same company her IHS worker worked for. So that she was brand new to them as well as brand new to us. She had a hard time remembering her medications or medication adherence. You heard Alan earlier talk about medication adherence, right? I think a lot of people hear that term, medication adherence, and it's kind of taboo. It sounds negative. It sounds like you're not doing a good job with your medication. It sounds like has a very negative connotation to it. So I want to take a minute to talk about, in the medical community, what it means to have medication adherence. So a practitioner, a doctor, a physician's assistant, a psychiatrist would prescribe a certain medication at a certain dose and in certain time allotted segments for the best therapeutic level for that individual, for that client, okay? So the idea is if you take your medication as directed, that it will stay in your system, in your body, in that therapeutic level and do what it's intended to do. High blood pressure medication, you take once a day, twice a day, at the level you're supposed to take it on a regular basis, and you get decreased blood pressure, right? It seems very simple. So in medical speak, because I like to say medical speak, in medical speak, medication adherence means, are you following our directions and guidance on how to take that medication so you get the benefit of what you're supposed to take? It's important for two reasons. If you have big dips and lulls in certain medications, you can actually have worsening side effects because you had dips and lulls in that medication than if you were never taking the medication to begin with. And you can also, if you take it too frequently, because some of our waiver clients out in the community think, oh, this medication's so good, I'm gonna take 2. I'm gonna take it 3 times a day. I'm gonna double the dose because it's so great. There certainly can be some negative effects of that happening as well in our systems. So that's what we mean by medication adherence. So when you hear it, it's not taboo. It just means, are they taking it as directive so that it stays therapeutic, but it also stays safe? This particular individual also had a hard time remembering if she already took her medications, meaning she might take her medications in the morning. 2 hours later, she couldn't remember if she took it already. Did I take that medication previously? Do I need to take it again? Do I just not need to take it at all because maybe I took it earlier? Again, that goes back to that issue of falling out of that therapeutic range because she can't remember if she took it. She had a hard time remembering other appointments. By other appointments, I mean with her IHS worker. If her IHS worker was coming at 11:30, she would show up. Client S would still be in bed asleep because she forgot that she had that appointment. So she'd have to get her up, get her dressed. Then they could go grocery shopping. Well, now that's dipping into her small allotted time that IHS worker had with her for the day. So with the system, we're going to talk about how all of these things can help out. So hybrid telemedicine as a whole, when we meet with these individuals, the nurse comes out for the very first interaction to tell them about what hybrid telemedicine is. From that moment, that nurse is pivotal because they're doing basically a nursing assessment. How is this person responding? What are their needs? How can our system support them in their home? What aspects of our system might be challenging for them and they might need extra support? But they're also forming a relationship. They're forming a rapport with that client. And as you know, for our clients out in the waiver program, out in the community, having a rapport with someone they trust is huge. So that nurse stays with them from that first interaction where they're actually talking about the services. They stay with them through their entire time through the program, as long as possible. So remembering to take the medication. Our system has a device that's when it's loaded and programmed, and the consulting nurse can assist with that. When it's loaded, it will show an audio and visual reminder through their TV set. So the TV will flash. The TV will say out loud, your 9 a.m. medications are due now. The machine will open. If the meds sit there for longer than 10 minutes, then the machine itself starts to play a tune to remind them to take their medication. This is a 2-hour process. So they're going to be annoyed enough that they're going to take their medication. So that's how the system can help remind them to take their medications. What if they already took their medication? The other side of that is, once they take their medication, a signal goes up into their TV and logs onto one channel on their TV, a check mark, a green check mark that says your 9 a.m. medications were taken. So if that individual 2 hours later says to herself, oh, I can't remember if I took that medication, she just changes it to that one channel on her TV, and it'll show that she's already taken her medication for the day. Other appointments. This is the collaboration really between the IHS worker and the client themselves. This person specifically was struggling with those other appointments outside of, personal appointments that she had, grocery shopping trips, things like that. So the collaboration happened when the client said, is there any way you can remind me when I have a grocery shopping trip or when I have to turn in that form for that thing at the county? The IHS worker said, yeah, is there any way that I can help her with that? She gets a username and a password. As long as the client approves, she can have a username and a password through a laptop or an iPad or a tablet. The IHS worker can log onto her account and enter their personal events reminders onto her calendar. That same channel on her TV that says, you need to take your 9 a.m. medication, will also tell her, your IHS worker will be here at 10. So they can program that in for her. So she has that audio and visual reminder as well in her home. She also had a hard time communicating what her medications were. She didn't know what they were for. And the IHS worker was the same company was also doing a lot of her case management. And so they reached out to the nurse, the consulting nurse, and said, is there any way you can support us with this system that she has? Sure. Username and password. You can check on her to see that she's taking her medications, if she's missed medications. But also, there's a list of her medications, so you know what she's currently taking and what dosage. So she can check to make sure that she's getting her medications delivered or they're going out and picking up those medications for her. Did you have a question?
I have a question here. Sorry, I just wanted to make sure. So did you say that it would beep for 2 hours?
The actual device itself does not beep, it plays like a tune.
Okay, so it's not like extremely annoying.
Oh, it's extremely annoying. I would say it's extremely annoying, but in a good way. The idea is so they can't ignore it or turn it off. But once they take their medication, it goes off.
That it goes off. So, but it will make a noise for the full 2 hours, kind of like other reminder machines that are out there.
Yep, for an hour and 50 minutes. So the first 10 minutes, it doesn't, because it's trying to allow that person to remember on their own with the other prompts. And then after the first 10 minutes, it starts to play that tune like, hey, I'm still sitting here. You still have not come to get me, as a little reminder to them.
So then will it do the same thing with the IHS, hey, here's your appointment for your IHS worker. Will it kind of will it have a tune then for that too? So that it can go over?
Yes, it'll come up, well, that's specific to the medication.
Right, I understand that part.
But the TV will give a visual reminder, so it'll flash up on the TV, even if they're watching Gunsmoke, you guys, or Days of Our, what do people watch during the day now? Days of Our Lives? Do you watch, I don't know, whatever. You guys, we're at work during the day. I don't know what people watch. I don't think Oprah's on anymore. That was my generation. I don't know what people watch during the day, but during whatever they're watching, they'll get a visual reminder on the top of their TV, and then the TV will literally speak to them and say, it's 9 a.m., your IHS worker is coming, or a grocery shopping trip, or whatever they end up typing in.
But like what if it's like off?
If the TV's off, it still speaks.
It will.
Yes.
Gotcha. Okay, these were my questions.
TV can be off and they'll get the reminders even when the TV's off. Because even though the TV's off, it's not off.
So will it like turn on and like go across, or will it just talk?
Nope, it'll just talk. The TV will talk to you even when it's off.
So
Yep.
it's smart.
It's a smart TV. You guys, by the way, we're giving away that same 50-inch Sony smart TV at our booth. Go register. Get you a free TV. Tell them I sent you. Any other questions real quick? Oh, we got lots of questions. I love it. Oh, are you giving out these buffet tickets? Oh, perfect.
So my question was, you just mentioned the smart TV. So I was thinking of the iPad. Is this TV part of what goes in there with them?
Yes. So her question was, is the TV part of the system? Yes. We bring them the TV because the technology is part of that. It's baked into it. It also has a two-way speaker and camera that they have their telemedicine interactions through. And I think Alan mentioned briefly some remote patient monitoring devices, a thermometer, pulse oximeter. They could get a blood pressure cuff if there's somebody who struggles with blood pressure, a weight scale. All of those speak back to the TV and record all of those events.
Kind of like, I'm a nurse and social worker, and I'm inpatient now, but when I was in the clinic, we would do ferals and heart failure follow-ups, things trying to engage these people, and this is phenomenal because part of it.
It is phenomenal. Thank you. Did you all hear that in the back? She said, this is phenomenal.
All our folks on CADI and whatnot, and like you say, they have phobias, they have mental health issues and whatnot, and they won't leave their apartment and go to the mailbox, yada, yada, yada. So I come to the clinic, it takes 2 years to get them to come in. But if you could bring, and they haven't got access, they haven't got the computer or the iPad, you could have something like that come in, and you can then do some of the, simple nursing things to check in to see, are they fluid up, fluid down, things like that, where they felt like, and you're kind of annoying, but not super annoying, like with that whole reminder thing. I love that lady. I never heard about it.
And you said you're a social worker and a nurse?
Yeah.
Yeah, we get it.
Yeah.
We get it because we know these people are out in the community and they're not getting a lot of support, but we want to support their continued medical improvement. We want them to have those good outcomes. We want them to be independent in the community, but they can't do that on their own. I think there's one more question in the back, or two questions in the back.
There's one over here.
Oh my gosh, lots of questions. Forget about the rest of the slides. We'll just ask questions all day. I'm just kidding. Go ahead.
I just had a question. Is this ASL friendly at all?
Is this ASL friendly, American Sign Language friendly?
And blind also.
Not currently. It is blind friendly because a lot of it speaks to you, and you certainly can attach technology to it that can allow it to do that even more. We actually have a client who is completely blind, and she has her own setup system, and so she's connected this through part of her system as well, and so she works with it as well. But at this time, I don't think we have any adaptive ability for sign language. We're fairly new, but that doesn't mean that we won't get that. So we'll definitely work on that for sure.
And then my only other question that I have is, you were saying that you collaborate with a bunch of the other providers and workers. Do you also then offer the opportunity to collaborate with their primary doctor too, or is that something that you guys provide?
Absolutely. So her question was, you were speaking about collaboration with the other support care team members, IHS workers, PCAs, things like that. And she asked if we would collaborate and work with their primary care physicians as well, or practitioners. Absolutely. Because it's approved through the state, anybody can use it free of charge. You just have to have a username and a password. So if they want to see their physician through Alina, Health Partners, you name it, we give them a username and password, and they can come on and use the system.
So the nurse that you use, is that someone that comes out of this program, or are you coordinating and using like the line of healthcare nurses or the?
No, they're my nurses. I personally claim those nurses, so they're my nurse corps that work underneath me, yeah.
Are they how far out of the state are they going for that?
We are growing and expanding every day. So we're approved to every place in the state of Minnesota. So right now we're approved to go anywhere. And we are greatly expanding. Alan has talks with 15 other counties right now? 27. I was very wrong. Not 15, 27 other counties outside of the metro area. But even that being said, we already have clients all over the place. Our booth upstairs has a big map of the state of Minnesota. Come check it out. We have push pins in all the areas we already have clients, and then push pins for all the areas that we're currently working on getting clients. So the idea is we would have a satellite office in that area and have a consulting nurse in that area if it's farther away from the Twin Cities.
Are you finding nurses?
Well, I am finding nurses. You know why? Who asked that? I guess see him. Yeah, we are finding nurses. You know why? Because this is a great job. We're going out in the community and we're really serving people. You probably are aware that a lot of nurses are pushed to hurry, 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 next person, next thing in line, next da-da-da-da. No, we are finding nurses because they get to take time with these individuals, and the role is supporting them, educating them, advocating them. And that's everything most nurses went to nursing school for. There are select nurses that want to be in surgery, and that's their thing. But a lot of nurses went to nursing school because they actually want to touch somebody, they want to help somebody, they want to help educate somebody. And so this role, actually, that's all we do. As a consulting nurse, that's our entire job. Okay, so I'm going to move on. Okay, go ahead. One more, and then I'm going to move on to the next slide. Go ahead.
Sorry. Is this internet compatible or?
You have to have internet access in order to have this program, in order for it to work, because it's a smart TV. A smart TV needs Wi-Fi. So in areas, and we already do have several clients in areas that don't have Wi-Fi, they work with our team to make sure they can get Wi-Fi. And then we can pay for it too if it's a financial barrier for them. So we can figure it out, we can connect them with the right resources to get it connected.
And with the medication setup, if, let's say, medications are changed every week with the work windows or something, is the nurse going back out and resetting up the meds?
No, we are consulting nurses, so we don't do med setup. That's the only thing the nurses won't do is med setup, because we don't do skilled nursing. So that's something that is, as you guys all know, is a different sort of code. It's billed differently, it's built differently. They have to work for, most of those nurses have to work for a county or a big agency, we don't do med setup, but we can educate and support and collaborate on everything else to do with the system. And we do have some pharmacies that we work with. So if there is a lack of nurses doing med setup right now. So if they need meds delivered to their home, we do work with several pharmacies, and we can help connect them and get them transferred over to a pharmacy where their meds will be delivered and be pre-packaged, so it's by the time. Does that make sense? So if they take their meds at 8 a.m. and they take 10 different meds at 8 a.m., it'll come in a package that says 8 a.m. and has all their different meds on it. So it's much easier for them, with the assistance of a family member or a support team, to set those meds up in that device. If there's somebody who cannot physically do that and they don't have the support, we actually have an interactive version on the TV now that when they open that pill pack, even if they don't have that med reminder, they can click on the TV, because the TV will still give them that reminder. They can click on it and say, yes, I opened my pill pack, I took my pills, click, and they still get the credit in the TV, so it'll still show up with that check mark. Yep, okay, next slide. So mental behavioral health diagnoses and hybrid telemedicine. So as we know, people with mental and behavioral health can pose their own challenges out in the community. So the way they interpret a lot of our communication can be different. The way we need to handle our communication and our relationships with them can be different. So Client M, when Client M presented to this particular consulting nurse, she had uncontrolled or not effectively controlled schizophrenia. that was apparent by her disorganized speech pattern and communication issue. So if you're not sure what disorganized speech pattern is in collaboration with schizophrenia, if you haven't had the luck to work with somebody who has that, you can ask them a question, and the first 2, 3, maybe 4 words will answer your question, and then after that, they're kind of grabbing thoughts and ideas from all areas of their brain, so it might not make sense. Like you could say, Client M, how are you feeling today? Good. I hooked up the TV and then the sun came out and the grass is growing green and the birds went by, but you know, I like to grocery shop. And that might be their answer to you. And that's very common with people with schizophrenia. So again, that goes back to the importance of having that nurse with that interaction, because they're going to be able to recognize that and advocate for them and even help their support team understand how to best communicate and support her. So her IHS workers and PCAs that might be brand new, that consulting nurse can say, this is her. And so we need to support her in this and try to get, work with her communication and take a lot of that stigma out of it. She also had a lot of anxiety and a lack of trust for people. Well, if you have schizophrenia and you've had it for multiple years and it's uncontrolled, you're going to have a lack of trust for people, because out in the community, if you communicated to somebody else who was uneducated on schizophrenia that way, you would probably get a lot of odd looks. And so that makes a lot of sense that she would have that. She had a hard time with her medication adherence. I want to stop for a second and state that this medication adherence is different than our previous medication adherence. So our previous client had a hard time remembering to take her medication, right? Or remembering if she took her medication. Client M doesn't have a hard time remembering to take her medication. She knows when she's supposed to take it. She has a hard time after she takes her medication as she's supposed to, and it starts to put her into a therapeutic level. She actually starts to function pretty well. And a lot of the members of our mental health community start to think, well, I'm doing great. I'm functioning the best I have in years. I don't need this medication. I'm going to stop taking it. So why that's important to point out is, again, the consulting nurse not only is there to talk to them over the phone or text message them or go in person to their house, but the backside, there's a robust EMR. And so every time they take their medications or every time they don't, that consulting nurse also sees that. So if we see a repeated pattern of missed medication, it's going to prompt a phone call. Hey, Client M, I see that you've missed 4 days worth of your medication. What's going on? Are you not getting your medication? Is your machine broke? Did your nurse that does your med setup not show up this week? What's happening? So it'll prompt some communication with that individual. And if it's that they feel like they don't need to take it anymore, well, that's going to prompt a visit by that consulting nurse to go, let's talk. Again, with the collaboration, if that individual works with an IHS company, that might be something that they would also want to know. Hey, my individual, I see them 2 times a week, but now I know they haven't taken their medication because Client M is allowing me to be part of this system with them. That's a support that we can put in place for them. We can talk to them about that and educate them on that subject. This is, again, it supported the IHS workers and the PCAs too for this specific individual, so they could help educate her and collaborate with her and make sure she was getting her meds on time and make sure that she was getting her visits with her psychiatrist at home. Access to transportation. This should be the fastest slide of the day, right? So Client B had bipolar with major depressive episodes, plus she had PTSD and multiple other medical diagnoses that she was dealing with. She was fully disabled and dependent on the state for all of her financial needs. I think I could stop right there and just say, well, there's going to be an access to transportation issue, right? She did not have a driver's license nor a car. And quite frankly, if she did have a driver's license, she would have no place to put that car. She would have no way to get that car. She would have no financial way to support that car. Something happened to that car, she could not pay to repair it, right? So transportation is a huge issue for her. So obviously, hybrid telemedicine is a good option for her, because for her physician appointments, her psychiatrist appointments, whatever she's having, she can place them at a time in the day in her home. She doesn't have to go anywhere, and it can be at a time that's convenient for her as well. The consulting nurse comes out and is present for all those interactions, make sure they go smoothly, make sure they're advocating for the patient and the patient's understanding everything. But the biggest thing is they're not having to figure out how they're going to get to that appointment. She also had a hard time remembering times and dates of medical appointments that were out in the community. Again, this system helps with that because it would show on her TV that she has a medical appointment coming up in a week. We could put in a reminder, her IHS worker, or even the consulting nurse if she doesn't have an IHS worker or a PCA or a family member that helps support her. That consulting nurse can also go in and do that and shoot her a little brief reminder a day before, 2 days before, 3 hours before, to remind her that she has that appointment later on in the day. Any other questions I can answer real quick?
How would you handle somebody that is more holistic in their approach? They don't have, they don't take medicine, undiagnosed mental health? Is that create a challenge or barrier on your end?
Well, it can. Her question was, how do we handle somebody who deals with their medical care on a more holistic level and doesn't want to take medications or doesn't want to do other, doesn't want to get diagnosed?
Also has no prior medical, no reason within 10 plus years of actual medical care whatsoever.
Well, the individuals that sign up for this program and use this program have to want to use the program. So that's another reason why the nurse going out to that very first appointment where they're just talking to them about this is so important, because if they're clearly not going to use it, it's not going to be a benefit to them. I've been on appointments myself, you guys, out in the community where the individual needed more care than we could possibly ever support them on. And that was also not a good fit for our program. So that's why it's also pivotal that we get to know them at that first appointment, that we sit down and we talk to them. We're in their home, we can see their environment. You guys know, once you're in someone's home, you can see a lot of things about how somebody's caring for themselves or not caring for themselves. You can listen to how they communicate back and forth to you. So if someone's clearly saying, I'm not going to use this, I'm not going to do a physician's appointment on here, then it's not for them. But if they say, I'm interested in using the system, but I only see like holistic practitioners, then that's something that we can certainly provide. They can still see holistic practitioners through here. And we certainly have some individuals on our program right now that like to use alternative methods for caring for themselves outside of prescribed medication, if that makes sense. And we support them in that as long as it's working for them and not against them, then of course they'd be totally supported in that. And in the medical community, we really like to think that we're always holistically treating people. I'm pointing to our medical director, Dr. Dane Shipp, who's sitting over here. We like to think that we're always providing holistic care, which means we're looking at the entire person, especially nurses. We like to look at the entire person and go, what works for you may not work for the next person, but if it's working for you and you're benefiting from it, then that's something we need to think about, and that's something we need to support. So if they're wanting to use the system, absolutely.
And you could help them get connected to maybe the right type of physician, or?
We would certainly support them in that, yes. We would help them make any connections we possibly could, yes. Does that make sense? Okay. So improving the gap. So this is the gap of the misconnection and miscommunication that happens at medical appointments for our waiver clients out in the community. So hybrid telemedicine in this system can really help support that miscommunication. So again, the individuals are being supported with a consulting nurse at those appointments. And that's huge. That really helps with a lot of that lack of communication. Client Z, this specific client Z, had impaired cognitive function, so she wasn't, functioning as well as a lot of other members of society. She had slight dementia, like early onset dementia issues. She was illiterate and only had a 6th grade education. She couldn't read. And This is actually a client of mine that I'm speaking of. So she had chronic pain from trauma and multiple other co-diagnoses that she was dealing with. So why this is important is because of that consulting nurse. Not only can they use the system and use the devices to stay on top of their vital signs, their blood pressure, their weight. We have a glucometer system, so we have lots of different systems. But when they don't understand them, they have that consulting nurse to reach out to. So it's not just throwing them the system and walking away. And then having that rapport with that nurse again is really pivotal, because then they get to depend on that nurse that they can ask questions to. Like, I don't understand what he was talking about. He asked me about my hypertension. Well, I'm not tense. I don't know what he's talking about. And then the nurse could take a moment to explain to them that he's talking about your blood pressure and the best way to do this, and to explain to them whatever the next steps in the care plan process is. For this particular individual, it's also important because they're illiterate, so they can't read. Oh, have you been to a clinic or hospital visit lately? And they give you that packet of information when you leave that explains everything that happened. And there's a lot of words on those 4 or 5 pages, right? Stapled together. They hand it to you. She can't read any of that. So now if she can't remember what happened during her appointment, she goes home, she can't look at that as a resource. So the hybrid telemedicine system was also good because she always has that nurse as a resource. So assisting with social phobias and autism with hybrid telemedicine. This particular case study is with Client J and their family. Client J actually had an active family support in place. So Client J was low functioning, almost nonverbal. Not completely nonverbal, could say a few words, 2 or 3 words to form a sentence. Would use terminology that you and I wouldn't think to use to describe something they needed, but their family members understood what they meant, that sort of level. They had extreme anxiety surrounding leaving the comfort of their home and any public interaction. So any social interaction was really hard on this individual. And there was just too much stimuli. The lights, the sounds, the touches. You go to a clinic, nurses love to touch you. Touch. We're doing blood pressure, we're listening to your lung sounds, we're putting a pulse ox on your finger, you're sitting on a bed with that crinkly paper. Everybody loves that crinkly paper, by the way. And this was all too much for this individual. So, it really led to a lot of extreme exhaustion and mental and physical fatigue for this family. I cannot describe to you the extreme exhaustion and the mental fatigue this family went through. The client themselves, but also the family member that had to drag them to the clinic. So they would spend an hour trying to get this person ready to leave the house in the morning because they were so resistant. That spawned a lot of aggressive behaviors from their autism because they didn't understand why they had to leave. They didn't understand where they were going. Then they had to get into a vehicle. That spawned also more stimuli and more behaviors that they had to adapt and make changes for. Then they'd get to the clinic. They'd put them in a room where they would decompress and calm down because they had to do that before they could even have the interaction. That would take another 30, 45 minutes. They would finally see the practitioner they came to see. They'd spend 10, 15 minutes with them, and then they were out of there. That was it. Then they had to do it all in reverse to go back home. This took hours out of Client J's day. It was exhausting physically and mentally for Client J, but also for the family members. Having hybrid telemedicine, it was life-changing. Life-changing. I wish I had the family here. They sing our praises, you guys. They're just like, this is wonderful. We can set up the appointment at a time that's convenient for them in their home. They're used to having the TV on. Client J has the TV running in the house, so that doesn't bother them that they're having a telemedicine interaction through a TV because they're used to the TVs in the home. So that's huge. That nurse is pivotal because they get to know that nurse. They have interaction over interaction over interaction with the same nurse. They know her face. She's not a stranger who's coming into my home. She's my consulting nurse that's coming in, right? So they get to comfortable with her. They even got to the point that they were so comfortable with the consulting nurse coming into the home, because that's just one person, that this client started letting her do blood pressure readings, which nobody had been able to do before. This individual, I should go on to the next bullet point. This individual, I forgot to say, also has to be fully sedated for any blood work or any testing in a clinic or hospital, okay? They started to let this nurse do blood pressure readings, use the pulse oximeter on her, listen to the lung sounds, because they were so used to her that it wasn't frightening, it wasn't overstimulating at that point, and it was in the comfort of their own home. So this truly was life-changing for this family to be able to use this system. And they use it all the time, by the way, you guys. We have a lot of interaction with them. So on to the next slide. How can you, as case managers, social workers, how can you support good medical care and improved outcomes through hybrid telemedicine? Like how can you do that? We're going to talk about Client V. Client V had COPD, congestive pulmonary disease, so they have a hard time breathing, hypertension, high blood pressure, heart failure. So what we did, in this part of the system is not just that consulting nurse. I've been talking about that nurse, and that interaction is important for it to all kind of go smoothly. But they have remote patient monitoring devices that we give them as well. So Client B had breathing issues. Well, she has a pulse oximeter. So now every day, or multiple times a day, she can check her oxygen levels. That's important for a lot of reasons. A lot of times physicians, especially in years of the past, I hope they don't do this still, they would say, hey, I'm gonna give you some supplemental oxygen. I'm gonna write a script for that so you can have supplemental oxygen at home. And when you start to notice that you're short of breath, use your supplemental oxygen. You have COPD, you always are short of breath. You feel like you're always struggling to breathe, right? So to the patients, to the clients out in the community, they were like, well, what's that mean? Like, when do I use it? When do I not use it? Do I just use it all the time? So this makes it a little more clear. When your oxygen level is 92% or lower, use your supplemental oxygen. 90% or lower, 87% or lower, whatever it might be. Same thing with the heart failure, or excuse me, the hypertension. You have a blood pressure cuff. We give them a blood pressure cuff. With their heart failure, you can have fluid retention issues. That tells the physicians that care for them a lot of really good information about what is happening with that client right then while they're in their home. The blessing to all of this is that all of this information, once they use those devices, it goes up and records into their TV. So it keeps a week log, 2-week log, month log, 3-month log. So if the doctor says, I'm giving you a new blood pressure medication, let's see if that helps with your blood pressure and bring it down, I will follow up with you in 4 weeks. Most of the time, they will say, make sure you record your blood pressure readings. But the system, it records it. So then when that physician sees them again through the hybrid telemedicine system, they can see all 4 weeks of her blood pressure monitoring that she did at home. They have all that information. So then they can either adjust the medication up or adjust the medication down, add to that medication, whatever they need to do from that level. So all of this data is a real-time data for that practitioner on the other end of the screen. And you have to remember the consulting nurse also can see all of this. So if anything is ever out of range, you're noting that someone's O2 is going down lower and lower and lower every day, that consulting nurse would call them, hey, what's going on? I saw that your blood pressure is, kind of going up every day this week. What's happening? What's going on? Is something happening in your life? Are you not getting your medication? Are there dietary changes? What do we need to talk about? And sometimes just that conversation can spawn a, hey, I'm going to reach out to your physician, and we're going to set up another appointment. Is that okay? Can you do that in the next 2 or 3 days? And then that nurse might help get that started. So a lot of real-time data, which is vitally important. This really improves visibility into the home for these practitioners. So, practitioners see people at a clinic with walls, and so you see them for the time you see them, 10 minutes, 15 minutes, 20 minutes, whatever it might be, not usually 20 minutes. And so you know how that person's vitals are while they're sitting in front of you. Okay, when you came in today, your blood pressure was, your pulse was, your lung sound. But what about tomorrow? What about the day before you came in? What about next week? So this gives them real-time data even when they're not with them. And that's a huge step in healthcare. It really is helping to prevent and promote improved outcomes for these individuals. And then supporting independence. Of course, this platform is going to support independence. With Client T, they had newly moved from assisted living into an independent housing situation. And I believe it was, for this particular individual, I believe it was for financial reasons. They ended up moving from assisted living to independent housing situation. They signed up for the hybrid telemedicine platform. She had a hard time remembering to take her medications. And her main reason why is because in the assisted living facility, a nurse always gave her medications. Why did she have to remember when she took them? Somebody always gave them to her. So her meds were passed to her at that facility. She had a hard time once she got out into the community getting her medications filled, and that's because she's never had to do it. There's a pharmacy there's a pharmacy at the assisted living that does that all for me. So that was something that the consulting nursing team could help her do as well. And then of course she had decreased access to transportation. She didn't have a car of her own, but at the assisted living, if they needed to go out in the community for something, they had the little bus that showed up at the door and took a group to wherever they needed to go. Now she's not in assisted living, so that transportation issue is right back, that transportation barrier is right back in the forefront of her life. And this helped decrease that transportation for her. They even made sure that they set her up with getting her medications delivered to her home, so she didn't have to worry about spending her IHS worker time running to get meds. Now her IHS worker could take her to get groceries, take her to fill out some forms, take her shopping for furniture, whatever other people want to do out in the community, besides picking up meds all day long. So it really gave her a lot of time, but it also supported her independence and being able to do that, along with the support of an IHS worker or PCA or family member. And then as we know, the home is the lowest cost center of care. That's the cheapest place to be. Assisted living is expensive. Nursing homes are expensive. The urgent care in the ER is very expensive. They charge by the minute. So needless to say, being at home and being able to support your health care and have your team supported really is the lowest center cost of care for these individuals. And it really does foster that independence. It allows them to feel like they got some control back in the care of their lives. Lastly, how can a hybrid telemedicine platform assist with communication back to the case manager? So our system sends a monthly very simple bullet-pointed report back to the case manager with our interactions with the client. It's specific, does not contain any privacy details. Like we would not put on there, well, her blood pressure yesterday was, her oxygen was, but we may say, we've noted that she's used her blood pressure monitor 5 times this week. That's huge. It tells us she's using the system. It also might include her environmental factors, social determinants, any recorded supported interactions. The nurse has noted that she's had 5 telephone conversations and 1 visit with her this month. So it tells you that they're interacting and being supported on the system. And again, this is all sent back to the case manager. So again, I just wanted to highlight all of the barriers that we talked about. And of course, there's a million other barriers that I didn't talk about because we don't have time to. Thank you all so much for coming. Again, you can speak to us on the way out or up at our booth. We'd love to answer any questions that you might have, okay?